Hello and welcome to today's session. Today's we are reviewing this topic, guys. Is hypertension a genetic or a metabolic disorder? Your thought, guys? So, guys, what is a genetic disorder? Yeah, the difference between a genetic and a metabolic disorder lies in the underlying causes and mechanisms. So for genetic disorders are conditions that result from abnormalities or mutation in a person's genes or chromosomes. These abnormalities can be inherited from one or both parents and can occur spontaneously due to a number of mutations. The primary cause of genetic disorders is alterations of individuals' DNA sequence, which can affect the function of specific genes. So these alterations can lead to the absence or malfunctioning of critical proteins or enzymes that normally are necessary for bodily processes. So you know the gene DNA synthesis normally occurs in the S phase of the interphase. You have the G1, S, G2, and then we can go to the mitotic phase. So the S phase, that is where gene replication, DNA replication normally occurs. So genetic disorders can be inherited in a number of ways, and we have four main ones. Number one, you have autosomal dominant, which only affect one copy of the gene, could either be from the either parent, or autosomal recessive. This requires two copies of the gene, one from the father and one for the mother. We could also be having X-linked. This one affects genes on the X chromosomes, and males are highly affected here because you just need one for it to display the signs and symptoms. But for the females, they have to be homozygous. So that means it's hard for them to present the signs and the symptoms. Lastly, we have mitochondrial, and this one involves gene in the mitochondria. Examples of these genetic disorders include conditions such as cystic fibrosis, sickle cell anemia, Down syndrome, Huntington's disease, muscular dystrophy. What are metabolic disorders, guys? Metabolic disorders are conditions that arise from defects in body's normal biochemical processes, which affects the metabolism of the food chemicals such as proteins, carbohydrates, fats, and other essential substances in the body. Metabolic disorders are caused by enzymatic deficiencies leading to accumulation or deficiency of certain substances in the body. So these enzymatic deficiencies can be inherited, that is genetic, or acquired due to a number of factors like nutritional deficiencies or exposure to toxins. In terms of inheritance, that some metabolic disorders have a genetic basis. That is, they are caused by mutation in genes that normally code for specific enzymes involving metabolic pathways. However, not all metabolic disorders are purely genetic. Okay, some can be caused by external factors or non-genetic influences. So we say almost all genetic conditions can be metabolic, but not all metabolic can be genetic. Examples of metabolic disorders include, guys, phenylketonuria, the Tay-Chay's disease, the Gaucher's disease, and the maple syrup urine disease. So, guys, we can say that the difference between when discussing whether hypertension is metabolic or genetic, the difference lies in their underlying causes. So you find genetic disorders can result from abnormalities in the genes or chromosomes, while metabolic disorders are primarily caused by defects in biochemical pathways, which can lead to genetic mutation or other factors. Some metabolic disorders are genetic in origin, but not all genetic disorders are metabolic in nature. Okay? Both types of disorders can have significant impacts on a person's health and require proper diagnosis and management. So hypertension is also referred to as high blood pressure, saying that is a complex and multifactorial medical conditions that affects and results from a combination of genetic and environmental factors. It's essential to recognize that hypertension is not solely genetic or metabolic, but rather arises from the interplay of various factors. So hypertension is primarily caused by, very good guys, a combination of genetic and metabolic factors. In fact, it should be a combination of genetic, metabolic, environmental, and lifestyle factors. But D is the most appropriate answer. So hypertension we can have hypertensive urgency and hypertensive urgency. Hypertensive emergency is a condition in which there is elevation of both systolic and diastolic pressure with presence of acute organ disease. Whereas urgency is where the blood pressure is elevated, that's the diastolic, with absence of acute target organ disease. Okay? So what are the genetic factors that contribute to hypertension? There's evidence that suggests that genetics plays a role in hypertension. Okay? Family history and hereditary can increase the risk of developing blood pressure. Studies have identified specific variants associated with hypertension susceptibility. So these genes influence various mechanisms that eventually contribute to development of hypertension. Mechanisms such as sodium handling of the kidneys, regulation of blood vessel constriction, and hormonal signaling pathways all are involved in blood pressure regulation. So guys, what is true about the genetic components of hypertension? Hypertension is always caused by genetic mutations. Genetic factors play no role. Family history of hypertension has no impact on individuals' risk. Specific genes are influence blood pressure regulation and increase susceptibility to hypertension. Yes, so guys, the correct answer was D, and that's what you have said. Specific genes can influence blood pressure regulation and increase susceptibility to hypertension. So what is the correct statement about hypertension inheritance patterns? Hypertension follows a strict Mendelian inheritance pattern. All cases of hypertension are due to acquired mutations. Genetic factors in hypertension can follow various patterns, including autosomal dominant and autosomal recessive. Hypertension cannot be inherited. We have said, guys, genetic factors in hypertension can follow various inheritance patterns, and therefore we have autosomal dominant, autosomal recessive, the X-linked. Okay, guys. So those are the various patterns in which hypertension occurs, especially in the genetic aspect. Okay. Yes. Thank you so much. So hypertension resulting from genetic factors is more likely to be influenced by the family history. If you have the family history, that is likely to happen. The main mechanism of genetic hypertension is genetic mutations. It leads to genetic mutations that affect and contribute to increased blood pressure. So hypertension is primarily, yes, genetic disorder. Genetic susceptibility. Okay, genetic susceptibility will be exacerbated by diet, medication, environmental factors, and lifestyle changes. What are the metabolic factors that lead to hypertension? Metabolism refers to the chemical processes that occur within our bodies and has several factors under it. We have obesity, insulin resistance, dyslipidemia, and renal function. On obesity, we're saying excessive weight can lead to increased insulin resistance, activation of the sympathetic nervous stimulation, and the production of inflammatory mediators, which all contribute to development of hypertension. On insulin resistance, we're saying that we find that here in cells in the body do not respond to insulin, leading to development of elevated blood glucose level, mostly the diabetes type 2. Okay, so this can contribute to endothelial dysfunction, which affects blood vessel health and blood pressure regulation. On dyslipidemias, we have imbalance in blood lipid levels, such as the low density cholesterol, the bad cholesterol. So you find that, and low good cholesterol. So high bad cholesterol, the low density lipoproteins, they normally contribute to arterial stiffness, which eventually leads to development of atherosclerosis that raises the risk of hypertension, since the heart has to use more effort to pump blood through a narrow blood vessel. On renal function, the kidneys play a critical role in regulating blood pressure by controlling the balance of fluids and electrolytes in the body. So any impairment in kidney function can lead to hypertension. So guys, which of the following is a metabolic factor contributing to development of hypertension? Family history. This one is related to genetic. Okay. Aging, the physiological. Smoking, lifestyle. So the correct answer is insulin resistance. So guys, remember the blood pressure levels. Healthy population in elevated stage 1 hypertension, stage 2 hypertension, and hypertension crisis. Yeah? Yes. So the health is less than 120 and less than 80. Okay, crisis is over 180 systolic, over 140 diastolic. That is a hypertension crisis that can either be urgency or emergency. Great. Metabolic disorders can contribute to hypertension through which mechanism? Activation of the sympathetic nervous stimulation. Yeah, stress can do this, guys. Alteration of DNA sequence. Yeah, genetic factors use this mechanism. Yeah. Factors, environmental factors only. Guys, let's avoid these all-inclusive answers. Okay. Yes. So metabolic disorders can disrupt calcium balance. Okay. And that is one of the mechanisms. Insulin resistance, a metabolic condition, can lead to hypertension by activating the sympathetic nervous system. Yeah, we have said stress does this. Yeah. Yes. Affecting the regulation of blood vessel constriction. Guys, when you have insulin resistance, we have accumulation of glucose in the blood vessels, and this normally leads to endothelial dysfunction, and this affects the blood vessel constriction. So when the blood vessels are constricted, yeah, the heart has to pump blood at an increased effort pressure, resulting to a rise in blood pressure. Metabolic disorders related to hypertension can arise from which abnormalities? They rise in abnormalities in the blood vessels. Yeah, blood vessel dysfunction, endothelial dysfunction, and that contributes to hypertension. We have several metabolic disorders. Could be protein, carbohydrate, fats. Yeah, majority. The most common one being phenylketonuria. Phenylketonuria. Okay. Thank you so much. So environmental, after looking at both genetic and metabolic, it's high time we also look at environmental and lifestyle factors. So they also do play a role in development of hypertension. First one is diet. You find that studies have shown that diet high in sodium, processed foods, and saturated fats can contribute to hypertension. Equally, a sedentary lifestyle can lead to weight gain, insulin resistance, and elevated blood pressure. Chronic stress can activate the sympathetic nervous stimulation, release of catecholamines, which eventually leads to increase in heart rate, increasing the blood pressure. Use of tobacco and excessive alcohol consumption can raise the blood pressure. So which one of the following lifestyle can exacerbate hypertension in the individuals with a genetic predisposition? Smoking and excessive alcohol consumption. So alcohol consumption normally activates the sympathetic stimulation, leads to dehydration, stimulation of the RAS system, it disrupts the alcohol calcium balance, it leads to insulin resistance, it can lead to cardiotoxic effects, and also can contribute to weight gain and obesity. So what activation of the sympathetic nervous stimulation will lead to increase in heart rate and narrowing of blood vessels. This results in increased high blood pressure. Alcohol is a diuretic, so which means it leads to increased urine production. And increased urine production will lead to fluid loss and dehydration. So the body is dehydrated, the blood volume also decreases. So blood vessels normally constrict, and when they constrict, this is to maintain blood pressure. So this one normally result in temporal rise in blood pressure levels. About stimulation of the RAS system. Alcohol stimulates the RAS system, and the RAS system contributes to blood pressure regulation. So this constriction normally leads to constriction of blood vessels and increase in blood pressure. Alcohol can interfere with the balance of calcium within cells, affecting the relaxation and contraction of blood vessels. This disruption can contribute to elevated blood pressure. Chronic consumption of alcohol has been associated with insulin resistance. Okay, so insulin resistance can lead to various metabolic disorders that will lead to rise in blood pressure. Yeah, like the blood vessel dysfunction, blood endothelium of the blood vessel dysfunction. This results in increased blood pressure. Prolonged and excessive alcohol consumption can lead to direct damage to the heart muscles and cardiovascular system, leading to hypertension due to a compromised heart function. Alcohol is calorie dense, so excessive alcohol intake can contribute to weight gain and obesity. So being overweight, we have already said it gives you or it predisposes you to various dangers like insulin resistance, of which insulin resistance is going again to result in hypertension. So what role does dehydration play in alcohol-induced hypertension? It directly constricts the blood vessels, leading to temporal rise in blood pressure. So the activation of the nervous system, the activation of which nervous systems is responsible for alcohol-induced temporal increase in blood pressure? The sympathetic nervous stimulation, guys. So guys, age and gender are also significant factors here. So as people age, the risk for developing hypertension increases. You find that men are more at risk for developing hypertension compared to pre-menopausal women. However, after menopause, the risk catches up due to hormonal changes. In conclusion, we can say hypertension is a complex condition influenced by a combination of genetic, metabolic, environmental, and lifestyle factors. The relative importance of these factors can vary from one person to another, guys. So preventive measures and lifestyle modifications such as maintaining a healthy diet, regular exercise, managing stress, and avoiding tobacco and excessive alcohols are crucial in managing the risk of hypertension. So for individuals With a family history of hypertension or related health problems, early screening and monitoring are essential for timely intervention. So guys, this heading of if hypertension is genetic or metabolic is far from being reached. Okay, so generally hypertension occurs as an interplay of the various factors ranging from genetic, metabolic, environmental, and lifestyle. But remember, hypertension is generally primarily genetic, and genetic predisposition will lead to um, development of the abnormality. Thank you so much and see you again.